Hi, my name is Dr. Apazidis. I'm an orthopedic spine surgeon practicing at 57 and 7th Avenue in Manhattan, New York. So everyone is most concerned about what are the risks of spine surgery. And I think that people really forget the reason we're doing the spine surgery. We're doing spine surgery because there is already a problem. There's a problem where there's a herniated disc, there's a collapsed disc, there's stenosis or pressure on the spinal cord or the nerve roots, and there is already an existing problem. There's already an existing neurological problem. So we're doing the surgery to correct something. The risks of the actual surgical procedure are essentially the same really for any surgery. We are having to incise through the skin, and anytime you cut the skin, there can be bleeding, there can be infection. We take steps to avoid that. We use the typical surgical protocols, including intraoperative antibiotics, sterile techniques, instrumentation. They really have driven risks of bleeding and infection down to almost zero. Mostly people are concerned about, will I be worse with the surgical procedure? And what I like to tell patients is that, well, we don't do surgery to make patients worse. We do surgery to help people get them back to work, get them back to activities, get them back to enjoying their life. Of course, every surgery can carry a risk that there could be a problem or a deterioration, but I like to say that there's really been two lifespans of spine surgery. There's the lifespan of spine surgery from the 70s, the 80s, the 90s, and really even into the 2000s, where there were some bad outcomes. There were neurological risks, and there were some things that happened to patients that did make them worse and not better. In the last really 15 years, there's been a new age of spine surgery, and it really should almost be called a different surgery entirely, because it has almost nothing to do with the surgeries of your fathers and grandfathers, where there have been some bad outcomes and some bad history that tends to taint the kind of modern thinking about what spine surgery is. But in essence, for me, the major real risk is how much better are we going to make you? Sometimes patients want to get back to everything they were doing before their neurologic problem, and usually that is possible. It really depends on when we get to the problem. If we're early on and we can address things early, and I can do things in a minimally invasive way, and we can have fast recoveries and complete neurologic recoveries, then I think those risks of not being where you were before the problem are minimized. If it's really late in the game and there's already been long-standing neurologic problems, well, the chances of a surgery being able to correct those problems or reverse that type of nerve damage, it becomes less likely that it can be done. Now, I always like to say I have a story where I had a patient who came to me and he had years of numb arms, and he had just been deathly scared of spine surgery, and he came to me finally and said, I heard good things, and my arms have essentially been numb, and I'm getting even weaker now. And I asked him how long this has been happening, and he said, about 3 years. Well, I took a deep breath and I said, well, we can certainly do the procedure now. I know what your problem is, but the chances of achieving a neurologic recovery, it really has to be considered. Now, we can certainly stop the problem from getting any worse. And we do usually look for neurologic recovery up until 9 or even 12 months after a procedure. Well, we did the surgery on that patient. His pain got a lot better, but he still had numbness in the hand. And we understood that the numbness, again, may not come back. Fortunately, about 9 months to the day from the surgery, his numbness resolved as well. So, that's just one example. I don't want to say that everybody's going to have that same kind of experience under those circumstances, but I'd like to say that the risks of procedures have really been minimized at this time because of the new techniques that we're using, very small incisions, very protective procedures. We're using small tubes to access areas of the spine. We're not disrupting the muscles. We're not disrupting the discs above and below where we're operating. I think some of the risks that other people come to me and say, well, isn't it true once you've had spine surgery that you're never the same again and you're just going to need to have more spine surgery in the future? Well, I think that may have been true in the past, partially because some of the ways that they've approached spine surgery has given little regard to the muscles and the ligaments and the joints above and below the area that we're operating on. At this point in time, when we operate on a particular spinal level, we don't even see the other levels. We're only operating at that level. The other levels above or below are protected, they're not accessed, the ligaments, the muscles, all the tissues around them are not affected during the procedure. So they are preserved. And I believe that in the years to come, we're going to see a lot less of those problems where patients have the need for additional procedures after having an initial spine surgery. To find out more about orthopedic spine surgery or to seek a consultation, please go to my website, www.totalspineandsportscare.com.